Hello, hello, can you
Yes,
hear me?
ma'am.
Good morning, everyone.
Good
Okay,
morning.
good morning. For the today's class, we are going to start with the lung pleura. At first, we are going to learn about the lungs. Okay, now what is lungs? Lungs is the vital organs of respiration. There are two lungs situated in the thoracic cavity, one on each side of the mediastinum and enclosed in the pleural sac. A mediastinum is the middle cavity of the thorax cavity, is the middle compartment of the thorax cavity, okay? And the pleural sac is a bag-like structures which enclose inside the lung. The functions of the lungs is to exchange the oxygen and the carbon dioxide between the inspired air and the blood, okay? And is each lung it has a pyramidal in shape, and the base is rests on the diaphragm, the apex extending into the root of the neck. Right lung is larger and heavier than the left lung. The right lung it weighs more than the left lung. The right lung it weighs around 700 gram approximately, whereas the left lung is about 650 grams. The right lung has three lobes, whereas the left lung has two lobes, okay? And the lobes are separated by deep prominent fissures on the surface of the lungs and supplied by two lobar bronchi. The lung attached to the trachea and the heart by principal bronchi and pulmonary vessels, respectively. The external feature of the lung are the apex, the tip at the upper region of the chest of the lung. It is this part of the lung is known as the apex, pointed side of the lung, okay? Whereas the base is the part of the lung which rests on the diaphragm. And the borders, they are the boundaries in between each surfaces of the lung. We have a surface like the anterior, inferior and mediastinal part, okay? And the medial part of the lung. So in each of the surfaces it is bounded by a boundaries. What is apex? Apex of the lung is blunted. It extends into the root of the neck. 3 centimeter 3 centimeter of first ribs above the first ribs, and 2.5 centimeter at the medial end of the clavicle, okay? What are the relations of the apex of the lung? Anteriorly, the apex of the lung it is present by a subclavian vessels or a subclavian, this one, okay, subclavian artery, then the anterior scalene muscle, okay, and the internal thoracic artery, yeah. Posteriorly, it presents a ventral ramus of the first thoracic nerve, the sympathetic change, and the first posterior intercostal artery and vein. What is the base of the lung? The base of the lung, this is the base of the lung, this portion, okay? This is the base of the lung, it is concave, right? The base of the lung is a lower semilunar concave surface. It is the lower semilunar. Semilunar, it is not all circle, okay? It is like half half moon like shape, the base of the lung, okay? It is a lower semilunar concave surface that rests on the dome of the diaphragm. In between the liver, in between the thorax and the abdomens, we have a diaphragm where the lung it is resting on it, okay? This is the lower surface of the base or the base of the lung. It also known as a diaphragmatic surface of the lung, okay? The relations of the base of the lung. The right lung is separated from the liver by the right dome of the diaphragm, whereas the left lung is separated from the spleen over here, the spleen and the fundus of the stomach by the left dome of the diaphragm. The borders of the lung. This is the anterior border of the right lung. To compare with the left lung, the anterior border of the left lung, it has a cardiac notch and a lingula. Lingula is a tongue-like projections of the lung, okay, below the cardiac notch. The anterior border is thin and shorter than the posterior border. See, this is the anterior border. It is shorter than the posterior border of the lung, right? And it is also thin, whereas in the posterior border, it is blunt. It is not sharp, the border, okay? The cardiac notch and the lingula is present on the left side of the lung at the anterior border. Comparing with the anterior border of the lung, we see it is very sharp, right? Linear and sharp, whereas the posterior border, it is blunt. It is not prominent, okay? It is thick and rounded. It extends from the posterior border of the lung, this posterior border of the lung, this portion. It extends from the spine of the C7 vertebra of the spine to the spine of T10 vertebra. Just imagine at this level where the posterior border of the lung started or begins. At this level, we have a C7 vertebra. At the lower portion of the posterior border, we have a T10. So this means that the posterior border of the lung, it extends from the C7 vertebra to the T10 vertebra of the spine. Okay. What is the inferior border? Inferior border, you see, it is bounded in between all the costal surface, all the surfaces of the lung and the inferior surface of the lung. This border, this is the inferior surface, inferior border, okay? Sharp elevation of this portion of the lung at the lower edge, okay? This is the inferior border, you see. It is semilunar in shape. It is not completely circular, okay? It is not rounded, it is not circular. It is semilunar in shape. And it separates the base. This inferior border separates the base of the lung or the inferior surface of the lung, or also known as the diaphragmatic surface of the lung, from the costal or the medial surface of the lung. You understood?
Yes, ma'am.
Okay. Now we are coming to the surfaces of the lung. Costal and medial surfaces of the lung. The costal surface, it means the part of the lung which are related to the thorax, okay, to the thoracic wall, okay, whereas the part of the lung which is related with the heart or with the medial compartment of the thoracic cavity, this is known as a medial surface of the lung, okay? You understood? This is medial surface of the lung. It is related medially with the heart or with the mediastinum, okay? Costal surface is large, smooth and convex. Number of ribs related to this costal surface, 6 upper 6 ribs in the mid-clavicular line. When we say mid-clavicular line, let us just imagine over here we have a clavicle bone, okay? Clavicle bone. In the middle of the clavicle, a vertical line at the mid-clavicular junction. The number of ribs related to the costal surface of the lung are the upper 6 ribs. This is the upper 6 ribs, like this. Okay. The upper 6 ribs anteriorly are related with the costal surface of the lung at the mid-clavicular line. Okay, mid-clavicular line. It means in the middle of the neck, middle of the clavicle. Okay, whereas the upper 8 ribs in the mid-axillary line are related here. And we see 1, 2, 3, 4, 5, 6, 7, 8 here. Okay, this 8 ribs. This is the 8 ribs. Okay, the ribs number 8. Okay, this at the middle of this mid-axillary line, we have over here the axilla region, right? Whereas the thorax cavity at the upper part of the thorax, it is known as the medial surface of the axilla. So we can see at here the number 8 of the ribs is related, the upper 8 of the ribs are related with the costal surface of the lung, and the upper 10 ribs in the scapular line. Where is the scapular line? Okay, over here posteriorly on the back, the ribs from the ribs number 10, okay, are related with the costal surface posteriorly at the upper 10 ribs are related with the costal surface of the lung posteriorly. Okay, you understood that?
Yes, ma'am.
What is the medial surface of the lung? There are two parts. Okay, we have a vertebral part. This is the anterior part of the lung. Okay, anterior part of the lung or the anterior surface. This is the posterior surface of the lung. Okay, and then posterior border of the lung, and the medial surface of the lung. It consists of two parts, that is the vertebral part and the mediastinal part. Okay, this is mediastinal part and the vertebral part. The structures forming the right surface of the mediastinum. What are the structures that forms the right surface of the mediastinum? Mediastinum is the middle compartment of the thoracic cavity. Okay, the thoracic cavity, it has 3 compartments. Okay, right lateral compartment, left lateral compartment, and the middle compartment, also known as a mediastinum. Okay, so at this mediastinum, on the mediastinum, there are structures that forms the right surface of the mediastinum. Around this region, okay, on the left lung, we will be having on the right lung, okay, here at this region on the right lung, the structures related to this mediastinal surface of the medial part of the medial surface of the lung, it is related with the right atrium of the heart. Okay, and then with the superior and inferior vena cava. Okay, then a brachiocephalic vein. Okay, azygos vein, in here we cannot see, it's over here, azygos vein. Then the esophageal around here. Okay, on the right lung behind the trachea. This is a bronchus. Okay, a primary bronchus. Behind this primary bronchus, there will be a esophagus. Okay, then a right phrenic nerve. We can see it will lie around this region, the right phrenic nerve. Okay, and it's along with it there is a sympathetic change. Okay, then the structures that forms the left surface of the mediastinum. This is the left mediastinum. What are the structures which are present in the left mediastinum? And this left mediastinum is related with the medial surface of the left lungs. Okay, the left ventricles, this one, then the ascending aorta, this one, it is related with the upper part of the lung or the apex, not the apex, below the apex, ascending aorta, this is the ascending aorta, this is the arch of aorta. Okay, then the descending thoracic aorta behind this, around here. Okay, it is related here. Here ascending aorta, then arch of aorta, then descending thoracic aorta. Okay, then the other structures related to this left mediastinum are left subclavian vein, this one, okay, and the carotid artery, this one, red color, and then the esophagus, the same thing, behind it, present posteriorly, and the thoracic duct, over here it will come, the thoracic duct. At this point it will join, or it will communicate with this part of the subclavian, it will drains into this subclavian vein, the thoracic duct. Okay, the left side of the subclavian vein, it drains by a thoracic duct, which is a lymphatic. Thoracic duct is a lymphatic. Remember that. Azygos vein and the thoracic duct are the vessels which can drain all the lymphatic system into the vein at this region. Then the left phrenic nerve over here, this one, at the left border of the heart. Then the left recurrent laryngeal nerve over here, this one. Okay, it curves below the arch of the aorta, along with the vagus nerves and the recurrent laryngeal nerve, there is a sympathetic change. So now, what are the lobes? What are the fissures? Lobes and fissures of the lung. On the right lung, we have 3 lobes. This one is superior lobe, middle lobe, and inferior lobe, whereas on the left lung, we have only 2 lobes, that is only superior and inferior, with no middle lobe. Okay, there are 2 fissures on the right lung, therefore it is divided into 3 lobes. 2 fissures, one is oblique, this one is oblique fissures. Okay, and this another fissure which is almost horizontal, this is known as a horizontal fissures. On the right lung, same thing. On the right lung, 2 lobes are divided by an oblique fissures, whereas on the left lung it is divided by only a oblique fissures. What is oblique fissure? A long oblique fissure runs obliquely downward. This one, oblique fissure, 2 oblique fissure on the right lobes, right lungs. Okay, do you understand? 2 oblique fissures on the right lung. One is superior, okay, to divide the superior lobe of the lung and the inferior lobe of the lung, and another oblique fissure which divides the middle lobe and the inferior lobe. Okay, a long oblique fissure runs obliquely downward. It runs downward like this, and crossing the posterior border. It crossed from the anterior, then to the costal surface, and then to the posterior border. Okay, it crossed the posterior border about 6 centimeter below the apex. Below the apex at 6 centimeter, it presents a oblique fissure which is crossed the posterior border. Okay, and about 7.5 centimeter lateral to the midline. On the lateral surface. This is the midline. Okay, this is the midline. The oblique fissure, it comes like this, one like this, then it curves behind like that, it curves upwards, and then it ends like this. Okay, it started like this, then from the medial surface it crossed and it divides also the middle and the inferior lobe, and posteriorly it crossed the posterior border of the right lungs. You understood? That is 7.5 centimeter away from the midline. This is the oblique fissure. It separates the superior lobe and the inferior lobe. Okay, but anteriorly we cannot see that, it is not prominent that the oblique fissure separates the superior lobe from the inferior lobe. Okay, we can only see from the medial surface of the lung. Okay, then the horizontal fissure. This is the horizontal fissure. It is only present on the right lung. Okay, a short over here, it extends like this from the medial surface of the lung, it extends anteriorly in this way. Okay, a short horizontal fissure is present only in the right lung. Okay, it starts from oblique fissure at the mid-axillary line and runs horizontally forward to the anterior border of the lung. You see, horizontal fissure, it begins from the oblique fissure. You see, this one is oblique fissure. Then it begins from the oblique fissures and it crossed the anterior border. It crossed the anterior border of the lung and separates the superior lobe and the middle lobe. Okay, remember that oblique fissures, it crossed the posterior border of the lung, whereas a horizontal fissure, it crossed the anterior border of the lung. Oblique fissures in the left lung, this one, runs obliquely downward and forward. Okay, it runs obliquely downward and forward and crossing the posterior border. Same thing, the oblique fissure on the left lung, it crossed the posterior. It crossed like this, the posterior. This is the posterior. This is posterior border of the left lung. It's blunt, right? The posterior border. It crossed, like on the right lung, it crossed the posterior border about 6 centimeter below the apex. Same thing, like on the right lung, the oblique fissure is about 6 centimeter below the apex of the lung, and the inferior border almost at its apex. This is the oblique fissure at the inferior border of the left lung. The oblique fissure ends at the apex of the inferior border of the left lungs. It separates the inferior lobe and the superior lobe. What is root of the lung? You see this green color over here. This is the root of the lungs, where the structures communicating between the lungs and the mediastinal structures are present. This is known as the root of the lungs. Like the root of a tree, it goes deep into the ground, right? This is the root of the lung. The root of the lung is short. It's very short, the root of the lung. That's what we cannot see, like on anteriorly. When the heart is there, we cannot see the root of the lung because it is very short. Okay, connecting the mediastinal, it connects the medial. The root of the lung connects the medial surface of the lung with the mediastinum. The root of the lung connects the medial surface of the lung with the mediastinum structures or with the heart. The hilum is the area on the mediastinal surface of the lung through which the structures enter or leave the lung. The hilum, this is the structures leaving or entering the lung, the structures which are connecting the mediastinal surface of the lung and with the mediastinum. This area is known as a hilum. Okay, it is surrounded by a tubular sheath derived from a mediastinal pleura. You see this white color? This is a pleura of the lung, a visceral pleura of the lung, which is tightly or firmly attached to the surface of the lung. This one. This is the pulmonary ligament. Okay, the extending part of the pleura. The hilum or the root of the lung, it is enclosed inside by a pleura of the lung. That is the mediastinal pleura. Okay, it lies opposite to the body of the T1, T5 to T6 and T7 of the spine. You understood?
Yes, ma'am.
Okay. Components of the lung. Principal bronchus in the left lung. What are the components of the lung? Like this. This is the components of the left of the root of the lung. The principal bronchus in the left lung. Okay, this one. Okay, there are two principal bronchus on the left lungs. Okay, eparterial and hip arterial bronchi in the right lung. In the right lung, we have a eparterial bronchus and a hip arterial bronchus. Okay, on the right lung. Then the pulmonary artery. This one. Only one pulmonary artery on each lung. Okay. Pulmonary veins, 2 in numbers on each lung. Okay. The bronchial trees, one on right side and 2 on the left side of the lung. Bronchial arteries. This one on the right lung and 2 on the left lungs. Okay. Then a pulmonary vein inferior. We have a pulmonary vein on each lung. There are 2 pulmonary veins on each lung, superior and inferior pulmonary vein. Okay. Arrangement of structures in the root of the lung at the hilum. On the right side, from before backwards. This is the anterior border of the lung. Okay, anterior border of the root of the lung. This is the posterior border of the root of the lung. Anteriorly is present a pulmonary vein, superior pulmonary vein, then the pulmonary artery, then ape arterial bronchus, then hip arterial bronchus and a bronchial artery. Okay, from before backwards. Superior pulmonary artery, this one. Superior pulmonary vein, this one. Okay, then pulmonary artery, this one. Then the bronchus, these two bronchi, okay, on each lung. From above downwards, the arrangement of the structures on the from above downwards, it started with the ape arterial bronchus, okay, then pulmonary artery, this is pulmonary artery, then hip arterial bronchus, this one, and the most inferior one is the inferior pulmonary vein. Relations of the root of the lung anteriorly, this one we have already discussed before, so you can read it on your own, okay. Phrenic nerve, anterior pulmonary plexus, superior vena cava is present on the anterior root, like this. The same thing on here. Anterior, this is anterior on the right lung, okay. This is anterior part of the left lung. This is the anterior part of the left lung. This one, I mean. Yeah, this one. No time. Internal structures of the lung, also known as a bronchial tree. Okay. A trachea together with the primary bronchus on each side, then a secondary bronchus, then subsequently we have a segmental bronchus and alveoli, and the respiratory and the bronchioles, okay. This is the internal structure of a lung, of the also known as a bronchial tree. You see, it looks like a tree, right? The branches of a tree. So that's what it is called as a bronchial tree. Bronchial tree, it consists of the conducting portion of the bronchial tree, that is a trachea, primary bronchus, secondary bronchus, tertiary bronchus, also known as a segmental bronchus, till the terminal bronchiole. Till the bronchioles and terminal bronchioles, these forms a conducting portion of the bronchial tree, whereas a respiratory portions of a bronchial tree, it starts as a respiratory bronchioles. It starts from the alveolar duct, okay. It starts from the alveolar ducts. Respiratory bronchioles, it forms as a zone separating between the respiratory and the conducting portion of the bronchial tree. Conducting respiratory, the principal bronchus, also known as a primary bronchus. The lower border of the, it begins at the lower, okay, the trachea. The trachea bifurcates, okay, divides into primary bronchus just before entering the hilum of the lung. It divides at the level of the T4 vertebra, okay. The right bronchus, comparing with the left bronchus, is shorter and wider than the left bronchus. The left bronchus is longer and narrower, okay. The right bronchus, the right principal bronchus, it is mostly vertical inline, okay. It is mostly vertical inline, whereas the left primary bronchus is always acute, forms an acute angle, or it mostly horizontal, okay. It lies, the right bronchus, the right primary bronchus, it lies more or less in line with the tracheal lumen. You see, the long axis of the tracheal lumen, it always lie in line with the long axis of the primary bronchus. Comparing to the left bronchus, the left bronchus does not lie in line with the tracheal lumen, okay. It is forming like an acute angle. The right principal bronchus, this right principal bronchus, it deviates from the tracheal lumen, from the long axis of the trachea, about 25 degree, okay. Whereas in the 45 degree. Okay. That's what the left bronchi, it's almost horizontal because it deviates from the long axis of the tracheal lumen more than 25 degree. Okay, that is 45 degree. The angulation in children of the two main bronchi, this one, is equal on both sides. Okay, whereas in adults, the left bronchi will the left bronchus will be more horizontal compared with the right one. Whereas in case of the children, the angulation remains equal to each other. Then a lobar bronchus. A lobe bronchus, you see, we have a trachea divides into a primary bronchus, then a primary bronchus will divide into a secondary bronchus also known as a lobar bronchus. Okay, and a tertiary bronchus subsequently it divides, is known as tertiary bronchus or also known as a segmental bronchus. Lobar bronchus or secondary bronchus, there are three lobes right on the right lung. So a lobar bronchus will be present 3. Okay, 2 lobar bronchus will be present on left lungs because there are only two lobes of the lung. Okay, and segmental bronchus also known as a tertiary bronchus, one for each bronchopulmonary segment. You have to do an assignment on bronchopulmonary segment. Okay, can everyone hear me?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, one segmental bronchus, it represents one bronchopulmonary segment. You have to do assignment on bronchopulmonary segment. Then a terminal bronchioles. Then the last one is a respiratory bronchioles. This respiratory bronchioles represents the transitional zone or the part separating between the, is a zone between the conducting and the respiratory portion of the respiratory tract. Okay, between the trachea and all. Respiratory portion respiratory portion or the pulmonary units, respiratory portion of the bronchial tree. Okay, this portion we are going to read now. Okay, a respiratory portion or the pulmonary units of the bronchial tree, it is formed by a alveolar ducts. Okay, remember this respiratory bronchioles represents the transitional zone between the conducting portion and the respiratory portion of the bronchial tree. Okay, then the respiratory portion of the bronchial tree starts from the alveolar duct, not from the terminal bronchioles, not from the respiratory bronchioles. Terminal bronchioles is the terminal end of the conducting portion of the bronchial tree, whereas the respiratory portion of the bronchial tree begins from the alveolar ducts, and then we have an alveolar sac. Inside the alveolar sacs there are many alveoli. Okay, this respiratory portion or the pulmonary units of the bronchial tree concerns with the gaseous exchange. This is the portion where the gas exchange occurs. Okay, alveoli is the main site for the gaseous exchange. This is the portion. This will be a alveolar duct from here. This is the bronchioles, the respiratory bronchioles. Okay, this is the alveolar duct. What are the structures that forms the upper respiratory tract? The nasal cavity, then the pharynx, larynx. Okay, the lower respiratory tract, it is formed by a trachea. For the today's class, it means we are discussing the lower respiratory tract. Okay, can you hear me? The trachea, the primary
Yes,
bronchi,
ma'am.
secondary bronchus, then the tertiary bronchus, and till the end of the alveoli. This forms the lower respiratory tract. Okay, upper respiratory tract begins from the nasal cavity and ends till the larynx, just before the beginning of the trachea. Arterial supply of the lung. We have remembered the root of the lung. There are two bronchial arteries on the left lungs and one bronchial artery on the left lung. This one, bronchial artery on the right lung, one bronchial artery on the right lung, and two bronchial artery on the left lung. This bronchial artery supplies the bronchial tree. Okay, that bronchial tree. Three form like tracts of the respiratory system. Bronchial tree supply gives blood supply to the bronchial tree and the pulmonary tissue or to the lung tissue. Okay, what is pulmonary artery? Remember, pulmonary artery is present only one on each lung. Only one pulmonary artery is present on each lung. Okay, this pulmonary artery, it is a branch of a pulmonary trunk. Over here, this is a pulmonary trunk. This is a branch of a pulmonary artery is a branch of this pulmonary trunk. Okay, it's present only one on each side of the lung. Okay, and it divides subsequently along with the bronchial tree. Okay, and it supplied the and it carry this is pulmonary trunk. It supply deoxygenated blood to the lung. Okay, it comes from the right atrium, right ventricles of the heart. Then the venous drainage, it's accompanied the bronchial and the pulmonary arteries is accompanied by a bronchial vein and a pulmonary vein. Okay, the lymphatic drainage of the lung. Lymphatic drainage of the lung. There are two vessels that drains the lung. The lymph fluid of the lungs. There are two vessels: superficial lymph vessel, deep vessels. Deep lymph vessels. Okay, both superficial. Superficial means this one on the surface and the fissure of the lung. It is drained by a superficial lymph vessels. Okay, deep lymph vessels, it means which drains the bronchial site, the primary, secondary, then the tertiary lungs, tertiary bronchus. Okay, these are the deep vessels which drains at this portion, and all these limbs from the superficial and the deep lymph vessels, it drains into the bronchopulmonary or a hilar lymph nodes. Okay, over here, this is a bronchopulmonary lymph nodes. Both deep and superficial drains to the bronchopulmonary lymph nodes and then to the tracheobronchial lymph nodes, superior and inferior tracheobronchial lymph nodes, and then it subsequently drains to the paratracheal lymph node. In some cases, we have a lymph nodes in front of the trachea is known as a pretracheal lymph nodes. Okay, then from pre and the paratracheal lymph nodes, it drains into the bronchomediastinal lymph trunk. Okay, at this region, this is the lymphatic trunks, bronchomediastinal lymph trunk. Finally, it drains into the lymphatic ducts. This is the thoracic duct. Finally, on the left side, the lymph will drains into the thoracic duct. Okay, whereas on the right side, lymph will drains finally into the lymphatic ducts. Okay, The nerve supply of the lungs. What are the nerve supply of the lungs? They are both supplied by a parasympathetic and sympathetic nerve fibers. Okay, both parasympathetic and sympathetic nerve fibers supply the bronchial muscles. Okay, these bronchial muscles will respond according to the nerve supply. If it is supplied by a parasympathetic nerve, it will cause the bronchial muscle to be constricted. Okay, that is known as a bronchoconstriction or a bronchospasm, and it will cause a vasodilation, and it will increase the mucus secretion. You understood? Then if a bronchial muscles of the respiratory tract supplied by a sympathetic nerve, if the stimulation of the sympathetic nerve fibers started, then it will cause a bronchodilation or vasoconstriction and decrease the mucus secretions. Okay, both of these will be supplied the respiratory tract or the respiratory system. Okay, the parasympathetic nerve derived from the vagus nerve, whereas a sympathetic nerve will be derived from the spinal segment. Assignment to be done. Okay, you have to submit at any time the assignment on broncho. Explain the bronchopulmonary segments. A pleura membrane now. A pleura membrane is a serous membrane lined the flattened epithelium. Okay, the epithelium which covers the lungs is known as a mesothelium. This mesothelium will secrete a watery lubricant, and it is known as a serous fluid. There are two layers of the pleural membrane. One is the one which is attached firmly, okay, very tight to the lung surface, is known as a visceral. Visceral means organ. Okay, the pleura which attach directly to the surface of the lung is known as a visceral pleura, whereas the outer pleura, the external part of the pleura, is known as a parietal pleura. This parietal pleura will line the thoracic wall. Okay, these two pleura are separated from each other, and the space between these two pleura will form a potential space, and this space will be known as a pleural cavity. And this two pleura, it is continuous at the hilum of the lung. Okay, visceral pleura, it covers the surface of the lung except at the hilum. Okay, this one, visceral pleura covers the surface of the lung except at the hilum, and it extends into the depth of the fissures of the lung. Okay, this one, visceral pleura. Okay, it attached to the surface of the lung, and it extends also into the fissures of the lung. Okay, and you cannot be easily separated it, whereas the parietal pleura is thicker than the visceral pleura, and it lines the walls of the thoracic cavity. Okay, this one. This yellow color here is visceral pleura, and around here is a parietal pleura. There are subdivisions of the parietal pleura: a coastal parietal pleura, then the diaphragmatic parietal pleura, then mediastinal parietal pleura, and the cervical parietal pleura. Okay, the pulmonary ligament. Remember the root of the lung? It is bounded by a mediastinal pleura, and this extending portion of the pleura below the root of the lung is known as a pleura-pulmonary ligament. Okay, the pleura surrounds the root of the lungs, extending down as a fold. Okay, it's like a cuff of the shirt. Okay, it's like this. this extending portion which form as a fold, this is known as a pleural pulmonary ligament. Then the fold is filled with a loose areolar connective tissue and contains few lymphatics. What is the function of this pulmonary ligament? It helps and provides a dead space into which the pulmonary veins can expand during increased venous returns during exercise. Okay, the venous return will be increased during exercise because of the presence of this pulmonary ligament, so it allows the blood flow to return easily, okay, and it allows the descent of the root during inspiration. During a deep inspiration, the structure inside the root of the lung will descend downward, okay. This is the functions of the pulmonary ligaments. The recesses of the pleura. The pleura, the area of the pleura reflection. You see this pleura reflection at this area, the pleura reflection on the diaphragm and mediastinum. A space which form at this area is known as, which is greatly expanded, is known as a recess of the pleura. Okay, this expanded region of the pleural cavity is known as a pleural recesses. The recesses of the pleura are essential for the lung expansion during deep inspiration. Okay, there are two main recesses prominent in the body. One is costodiaphragmatic recess and another one is a costomediastinal recess. Costo means ribs, okay? Diaphragm means the dome of the diaphragm, this portion. In normal chest X-ray, the costodiaphragmatic recess is very sharp, you see, whereas in abnormal lung diseases or in pleural effusion, this recess is blunt. Maybe if it is filled with a fluid, like in case of a pleural effusion, this recess will be blunt. It will not be sharp. In case we can see a costomediastinal recess, this portion. Normal X-ray is very clear, right? Sharp and very clear, the costomediastinal recess, whereas in an abnormal X-ray we can see it's blunt and it is overshadowed, it is opaque at this region, we cannot see the recess. There are some other small recesses. Retroesophageal recess is the extension of the pleural membrane behind the esophagus. Infracardiac recess is the extension of the pleural membrane below the inferior vena cava. The nerve supply of the pleura, okay. The viscera pleura, it is supplied by a T2, T12 spinal segment of nerve. This pleura, visceral pleura, is insensitive to pain, okay. Whereas a parietal pleura is more sensitive to pain. It is supplied by an intercostal nerve at the peripheral part of the parietal pleura. It means the peripheral part of parietal pleura, this one, the costal, cervical, costal and diaphragmatic, it is supplied by the intercostal nerves, whereas the mediastinal parietal pleura or the central part, it is supplied by a phrenic nerve, okay. This whole parietal pleura are sensitive to pain. That's all for today's class, okay. You understood, right?
Yes, ma'am.
Thank you so much. Please finish your
Excuse,
assignment and submit also
ma'am.
the whole assignment
Yes, ma'am. Ma'am, where do I have to submit?
at any time.
Ma'am, where we have to submit?
You can come only one person, okay, to bring the assignment. in the Department of Anatomy, level 1.
No, ma'am. We are
Minus
not
1,
allowed to
minus 1.
go
Oh, you are
outside
not.
our hostel.
Okay, no problem then. You read on your own that bronchopulmonary segment because it's important for aspiration.
Yes, ma'am.
I forgot to tell you that. Okay, I'll just show you this one question. I just remember right now. Okay, comparing with the left and the right bronchus. Okay, right bronchus are more prone to the aspiration. Okay, you understood? Comparing with the left
Yes, ma'am.
bronchus, left primary bronchus, left bronchus, it is not prone to the aspiration, whereas right bronchus is more prone for the aspiration because the long axis of the tracheal lumen is more vertical with the long axis of the bronchus, primary bronchus. Okay, right side will be more prone for the aspiration. You understood? Okay, bye-bye. See you.
Thank you,
Bye,
ma'am.
ma'am.
Welcome.
Thank you, ma'am.
Thank you, ma'am.
Yeah, thank you.